Losing more hair after using minoxidil for 1 month. I'm using minoxidil for the last 4 weeks, but now I've lost more hair. More than 100 hairs per day. Is it normal because I'm using minoxidil?
Thank you for your question. You submitted your question without a photo, and you're describing in your question that you've been on minoxidil for about 4 weeks, and that it is your observation that your hair loss is actually getting worse, to the point that you're counting over 100 hairs per day. And it seems that you're asking whether or not this is caused by the minoxidil. Well, I can certainly share with you how I discuss the use of minoxidil in my practice for patients who, like yourself, are dealing with hair loss. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan, Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers, a system we developed which was derived from the use of platelet-rich plasma and acellular matrix during hair transplant as an additional tool in the treatment armamentarium for men and women with genetic pattern hair loss. And we treat patients from all around the world, and we've been doing this since 2011. So I spend a lot of time putting the treatment strategies into context for people who are suffering from male pattern hair loss. And it's important to understand that the use of minoxidil may have a certain value based on its pharmaceutical effect, but its relative success for patients does vary. And it's important to also recognize that the drug, which was originally a drug for hypertension, for high blood pressure, had this side effect of hair growth. However, there is variable expression of male pattern hair loss. So in a situation, you can understand that there are people who start losing hair early and they lose hair very fast. There are people who start losing hair closer to their late 30s and lose hair very slowly. And there's wide variation in between. So it is common that patients will do something called a correlation-causation error, which means that they may use a drug like minoxidil, and because their hair loss is still progressing, they feel that the drug caused their hair loss. Kind of a temporal thing, but not necessarily a cause and effect. It's also important to understand that minoxidil is not the only treatment for hair loss, and that if you are progressing, you may want to also look at other strategies. And this is the discussion that I'll have with my patients. Essentially, to go over just the concept of hair regeneration, when we were doing hair transplants and we wanted to help our patients have better wound healing in the donor area, as well as better graft survival, the material that we used, acellular matrix and platelet-rich plasma, appeared to also stimulate hair growth. And so thinning hairs became thicker that were not transplanted. And from that, we derived a system to help patients maximize hair growth. And so what we do is essentially do an injection treatment, and then we watch our patients, and routinely we'll do also a booster injection around 15 to 18 months or 15 to 24 months, depending on a profile that I've developed from all these years of experience of treating so many patients from around the world. And basically the profile that I'm referring to is based on the gender, the age of the patient, the age of onset of hair loss, the rate of progression of hair loss, the degree of progression, as well as other variables such as the use of different drugs, the certain hormonal issues, and other medical conditions. That being said, it is not unusual for me to hear the story that someone tried minoxidil, they got frustrated with it, they abandoned it. or they tried minoxidil and thought that it made their hair loss worse. So when I see a patient and if they learned about hair regeneration and they want to come for a treatment, I also discuss with them the other options. That includes transplant. That also includes, for a man, the use of a DHT blocker like finasteride. It's very important to understand that regardless of the strategy, where no one is curing hair loss, what we're doing is we are working with your genetics to maximize the longevity and coverage of your scalp. So a lot of our patients who are describing a scenario like yours, where they're losing a lot of hair, and if it's a male pattern hair loss patient, then I'll say to them, well, even with hair regeneration, where we can really, independent of other drugs, make a big impact, I have attributed a certain level of DHT sensitivity based on a person's profile. So for a lot of our patients, I still have a discussion about DHT, and I'll put them also on a drug like finasteride. Now, of course, there's a lot of fear about finasteride, and we, in the medical community, still have a general consensus that the drug is effective and is relatively safe enough to continue prescribing it with consistency. That being said, the key to hair loss is not just DHT. We've had many patients who are on finasteride and they would still progress, but I feel that the DHT blocker did have value in sustaining the hair follicle longer than it otherwise would have been without the pharmaceutical intervention. Those same patients, I'll do hair regeneration treatment and their hair will get thicker. So while DHT blocking helps prolong the lifespan of the hair, the stimulation of hair regeneration results in better coverage. So ultimately there's a kind of a synergy opportunity there. Now if someone's been on minoxidil for extended periods of time, then I usually let them stay on it, because it's basically a strategy to control a variable. However, minoxidil has a certain pharmaceutical effect that is dependent on the drug being continuously applied and the relative responsiveness. And I would argue that it would be really dependent on relative DHT sensitivity and the rate of progression. So if someone has, let's say, someone in their late 30s to early 40s is starting to lose hair to the point that they're noticing something, that's somebody who has a later onset and probably has a slower progression. Someone like that generally seems to do well with minoxidil. In contrast, a younger person with the early onset and a rapid rate of progression generally doesn't seem to find any value in the use of minoxidil. So I would say that it's important for you to explore all the options you have to help you with your hair loss. That includes the drug finasteride, the technology of PRP, acellular matrix, what we call in our practice TrichoStem Hair Regeneration, as well as, of course, what everyone knows is about hair transplant, and see what strategy makes the most sense for you. And as far as the minoxidil is concerned, it is, again, without the benefit of more information and detail, I can't say that the minoxidil is not going to have any value in your long-term treatment strategy, but I think you have to look into other options in order to get the most optimal strategic benefit for your hair loss situation. So I hope that was helpful. I wish you the best of luck. Thank you for your question.